Welcome to the Human 5 Project, the podcast where we cut straight to the breakthroughs that matter, the show where science meets self-optimization. I'm your host, Ultimate Biohacker 10X, and here we break down the real research, real data, and real dosing behind modern biohacking, from compounds and peptides to techniques, devices, lifestyle strategies, and performance protocols. Most people jump in and jump out before they get the gold, so we're keeping it tight and delivering the essential insights you need without the fluff. If you've taken the time to hit play, we'll make sure you walk away with valuable knowledge that can transform your approach to longevity, health optimization, and beyond. Last episode, we broke down Sermorelin, Ipamorelin, and CJC-1295 with DAC, the stuff people use to push bigger, cleaner, the growth hormone pulses. Tonight, it's the other side of the blade. Because the growth hormone axis is not a toy. It's not creatine. It's not caffeine. It's not try it for 2 weeks and see how you feel. Tonight we're talking who should never touch the axis, what the long-term concerns actually look like, and here's the best part, how sleep, protein, and smart training can deliver most of what people are chasing without turning your endocrine system into a science project. Lock it in and let's go. What's up, team? Ultimate Biohacker 10X back on the Human 5 Project tonight. Straight facts, no filler, and no hype. Quick disclaimer. This is for educational purposes only. This is definitely not medical advice. A lot of growth hormone secretagogues get used off-label or as research compounds. Quality varies, outcomes vary, and risk is real. If you're going anywhere near hormones, clinician oversight, labs, IGF-1, fasting glucose, hemoglobin A1C, lipids, and if something feels off, you don't push through, you stop. Tonight is about red flags and the peptide-free alternatives that move the same dials. Cool? Well, let's move. All right, here's the adult list. If you're in any of these categories, you don't biohack the growth hormone IGF-1 pathway. You either stay out or you treat it like a clinical decision with a real medical team. 1. Cancer risk profiles. If you have active cancer, recent cancer, or high-risk history, especially hormone-sensitive cancers like prostate or breast, this is not the jump-in lane. Why? Because growth hormone and IGF-1 are growth signals. That's the point, and that's what they do. And if your body has any risk of abnormal growth, you do not casually turn up the growth dial. That's oncology clearance territory. Full stop. What I do know is this. Some large observational studies have shown that elevated IGF-1 levels are associated with increased risks of several cancers, including colorectal cancer. The theory is that IGF-1 promotes cell proliferation and inhibits apoptosis, which could potentially accelerate the growth of cancerous cells once they're present. For example, some meta-analyses have linked higher IGF-1 levels with a modestly elevated risk of colorectal cancer. However, these are associations, not proof of causation. No direct evidence has shown that using growth hormone secretagogues or increasing growth hormone levels directly causes gastrointestinal cancers. Still, the medical stance is pretty cautious. If there's a history of cancer, especially in hormone-sensitive tissues, clinicians avoid GH-modulating therapies. It makes sense. The relationship between growth hormone, IGF-1, and cancer risk is complex and not black and white. While growth factors like IGF-1 can promote cell growth, the evidence linking growth hormone or IGF-1 directly to cancer progression in humans is not definitive. Observational studies have noted associations between higher IGF-1 levels in certain cancers, but causation isn't proven. In clinical practice, medical professionals tend to err on the side of caution, like I mentioned before, for obvious reasons and for any cancer history, especially tumors with growth factor sensitivity. While it may not be a formal absolute contraindication, it's a serious consideration, hence why I spent a little bit of time on this particular topic. All right, number 2, prediabetes, uncontrolled diabetes, or significant insulin resistance. This one is huge because people chase recovery and they accidentally sacrifice metabolic health. Pushing the growth hormone axis can worsen glucose control in susceptible people. So if you're already running high fasting glucose, high A1C, or your metabolic markers are shaky, this isn't a maybe. This is a no. And if you're doing something under supervision and your fasting glucose starts rising, That's not adjust and continue. That's a stop signal. All right, number 3, pituitary history or endocrine abnormalities. If you've got a pituitary issue, a tumor, unexplained hormone problems, or anything weird in the endocrine orchestra, you don't touch the pituitary like it's a light switch. The pituitary is the conductor. You don't poke the conductor and hope the symphony gets better. Again, medical advice, medical direction, testing, and good decisions. Number 4, pregnancy or breastfeeding. No data, no go, no debate. Number 5, under 25 years old. Well, if you're young and developing, your growth hormone pulses are already high compared to older adults. You don't need to boost growth hormone. You need to sleep and train properly. Number 6, significant kidney or liver disease. Metabolism, clearance, downstream effects. Your margin for error is smaller. This is not DIY territory. Bottom line, if any of these apply, peptides aren't a playground. Even the cleaner ones come with unknowns. The question isn't, can I? The question is, why would I? Okay, let's talk about the stuff people don't want to hear. Short term, people mention water retention, tingling, appetite changes, sleep changes, maybe some headaches. But long term, here's the truth. Data is limited for many of the exact protocols floating around the internet. So you don't get to be reckless. You lean conservative. Risk number 1, glucose drift. This is the silent one. You can feel great, you can sleep deeper, your gym performance can improve, and your labs quietly slide the wrong direction. If fasting glucose is trending up, hemoglobin A1C starts creeping, or you noticed instability that you didn't have before, that's a red flag. Metabolic health is the foundation. Don't trade it for a pump. Risk number 2, fluid shifts and nerve compression signals. Tingling in the hands, numbness, carpal tunnel vibes. Sometimes it's mild. Sometimes it's your body telling you you're pushing tissue signals too hard. Listen. Risk number 3, IGF-1 overshoot. More is not better. IGF-1 isn't a trophy. It's a growth factor, and it's connected to growth signaling pathways you don't want to crank to the ceiling for no reason whatsoever. If you're driving IGF-1 high without a medical indication, you're trading today's feel-good for tomorrow's question marks. Risk number 4, escalation behavior. Not a chemical addiction, mindset addiction. People start relying on protocols instead of dialing in the basics. They sleep worse, they train sloppy, eat chaotic, and then they compensate by chasing bigger hormone signals. That's backwards, and that's the slippery slope. Risk number 5, the biggest real-world problem, quality control. Mislabeling, contamination, incorrect potency, sterility concerns. This is why it worked for my buddy really doesn't mean much for you. And this is why the safest alternative is don't make your body the testing facility. If you touch this axis at all, you measure, you track, and you exit when the signals go red. Now for the fun part. Because most people don't need peptides to get the benefits that they're actually chasing. They need discipline with 3 levers: sleep, protein, and training. And typically when I talk about the fundamentals, which include sleep, diet, and training, they're at the bottom rung of the ladder when we're looking at health optimization and longevity. And if you do these right, a lot of people get to 60 to 80% of the perceived upside, recovery, body comp, energy, without the unknowns. Lever 1, sleep. This is the master switch. The biggest growth hormone pulses are tied to deep sleep early in the night. So if you want more natural growth hormone signaling, stop chasing shortcuts and start protecting sleep like it's your job. Here's the core protocol. Consistency. Same bedtime, same wake time, even on weekends. Cool room, dark room, quiet room. Caffeine cutoff early enough anyway, so that you can actually drop into deep sleep. Light hygiene at night, because your brain doesn't know it's just a screen. It thinks it's daylight. And don't worship wearables. Use them as feedback. The real metric is simple. Do you wake up restored? Are you less inflamed? Do you feel human again? Lever 2, protein. Total first, then timing. People overcomplicate this. The magic isn't secret supplements, it's consistent protein. Hit an appropriate daily protein target, spread it across the day, prioritize high-quality sources. And if you want to play with a timing lever, some people like pre-bed protein to support overnight recovery. Not mandatory, but it's a tool. The point is, protein supports tissue remodeling, and tissue remodeling is what people are trying to buy with peptides. Lever 3, training. Intensity with intelligence. Growth hormone spikes with challenging resistance training and certain forms of high-intensity conditioning. Not endless cardio. There's a reason that you see the same people in the gym on those treadmills and the bikes. They look the same day after day, week after week. Can you imagine what the cortisol levels are? Here I'm talking compound lifts, progressive overload, real effort, then short bursts, sprints, intervals, done with control and recovery. You ever hear of the Norwegian 4x4? That's a cardio fitness exercise that actually has proven to increase cardiac performance and decrease morbidity and mortality. It's probably the only cardio fitness that I would even suggest in your training repertoire, okay? Anyway, and here's the key. If you train hard but recover poorly, you're not building, you're breaking. So the training lever only works if the sleep lever is dialed in. This is the synergy. Deep sleep, adequate protein, and intelligent intensity. That's the real stack. It scales, it compounds, and it doesn't come with purity concerns. And it changes your biology without turning you into an experiment. Here's the decision tree. If your sleep is inconsistent, if your training is random, if your protein is low, if stress is high, don't touch peptides. Because peptides amplify the system you already have, and they don't fix chaos. Natural first means you hit 80% compliance on sleep, you train with structure, you eat like recovery matters. You're not guessing, you're consistent. Now, when do people consider peptides? Typically when lifestyle is dialed in and they're facing limitations. Age-related decline, stubborn recovery issues, or specific clinical contexts. But even then, supervision, labs, conservative mindset, because you're not trying to be high, you're trying to be optimized. Bottom line, the growth hormone axis is powerful. Respect the red flags, don't chase numbers, and don't outsource your discipline to a vial. If you want most of the upside without the downside, sleep like you mean it, eat protein like recovery is the point, train like an athlete, and recover like a professional. That moves the same dials, peptide-free. If you want part 3, I can give you a couple options. Maybe we do a deep sleep protocol that actually moves the needle, or a conservative injury recovery stack. No circus, I'll signal. Drop your questions below, comments, recommendations, and smash subscribe. Stay sharp, stay skeptical, stay hacked, and I'm out, because sleep gets results. Thanks for listening to the Human 5.0 Project. If you found value in today's episode, share it with someone who's ready to elevate their biology. Make sure to follow the show for weekly deep dives into peptides, protocols, devices, lifestyle strategies, and the science of high-performance longevity. Until next time, stay curious, stay optimized, and stay 10x.